Thank you guys so much for joining us today. We're going to have a very exciting topic for you guys here today. I'm so glad that you can join us today. We've got Dr. Ferrara here, and he's going to tell us a lot about a subject that a lot of you have questions about. And this is why we're here. We're here to do this, to give you guys information about a lot of things that we're actually doing in here. So I want to know from you guys, the question today is, should you use antibiotics? And that's what we're going to be asking today. So, Dr. Ferrara, thank you so much for coming in. You want to say hi to everybody?
Hello, everyone. Good to see you guys this week. I hope you all had good holidays, and we're back for our weekly Facebook Live events.
Absolutely, absolutely. So thank you so much for coming in. And so this is what we're going to discuss today, guys. Should you use antibiotics? Because, sometimes people question different things about what should they do, what shouldn't they do. So it's just a matter of really what a person is looking for when it comes to, using the antibiotics. So I want to know from you guys, should you use antibiotics? So Dr. Ferrara, could you please let us know, what should we do?
Okay, the answer is yes and no. The reason we came up with this topic, flu season is coming up, and a lot of people have colds and flu, and the flu can be devastating. As you know, I would say close to 100% of people get over it just fine. Mm-hmm. There are some case reports, Dexter, where you read, and there's been very bad outcome and even help people, but those are rare and far in between. So a lot of people are sick and they want the magic bullet, and I think in the United States, and I think even around the world, people feel that the magic bullet is an antibiotic. They want the quick fix. And antibiotics do have their place in medicine.
Okay.
They do save lives. Mm-hmm. Think about the mortality before World War II, penicillin was invented, and afterwards it's been dramatic how many people we're saving now in infection. But there's a place for them. Part of it, you just need to understand that a virus and bacteria are two different things. And the difference is they're separate species, not like saying separate species between a dog and a cat, mm-hmm. but it's like a plant and animal. You have a totally different species. You would not treat a plant the same way you would treat a human being as far as surgery and things like that and the treatment of it. So for that same reason, and fungi is not the type of species, fungus. Mm-hmm. So it's totally different things that are causing us an infection. So as of today, as far as I know, there was nothing in the world that humans have come up with. And I always said, if we can put man on the moon, why can we come up with antiviral that gives the acute fix? And we haven't yet. Now, there's things that could help stop reproduction of viruses, but not for acute things. Those things would be like HIV. We have great HIV vets. That's a virus.
Now, what about? This is like flu season, and everybody seems like they're catching the flu. So, what about that? Can you tell us a little bit about, maybe that strain of virus or what's really going on right now?
The flu is caused by a virus called, a species of virus called influenza. Mm-hmm. And viruses are so small, you need a special neutron microscope to see it, to even see it. And the flu attacks our bodies, and what you really see in the side effects is that what you're getting sick is your body fighting it. And the body fights it with things like fever and chills and body aches and fatigue, because all its energy, it's going to fight this virus. And the body does a great job. If you're getting those symptoms, actually your body's doing a good job. And all the treatment that we like to give at least my clinic is basic supportive care. So if you're dehydrated, IV fluids, otherwise drink lots of Tylenol, Advil, and rest. And I do recommend chicken soup.
Okay. Because
especially lemon rice chicken soup, because of vitamin C, and drink lots of fluids. And those people do well. And no matter how you slice it and dice it, what you take, it's going to take 7 days for you to get over the illness. This season we've seen mild cases. Nobody's really had high fevers. Nobody's been super sick. They need to be hospitalized. They just need a supportive care. And then we check to make sure that what they think is flu is not a urinary tract infection or pneumonia or a complication for the flu, because really you can still get ear infections, strep, pneumonias, mm-hmm. and sepsis and other things from the influenza. So I always say, always check with your doctor when you have the flu, because you assume it's the flu. Sometimes it's not. Mm-hmm. But I know a lot of people discuss the famous one, Tamiflu.
Okay, right.
I agree in this one with the FDA and the CDC. there's no place for it really in a normal, healthy person in the treatment of flu. I know the advertisers will tell you do this, this, and that.
Okay.
To me, it's a way to get you to spend $200, and most people are really not going to notice the difference if they just had taken Tylenol, Advil, fluids, and rest. They wouldn't have noticed that notable difference to be $200. But also the difference, if you take it right when the flu begins, right first 2 hours, it'll shorten the course by 6 hours. You're still going to be sick for 7 days.
Can you say that once again, because that was very interesting what you just said?
Yeah, so the time it's really supposed to work if you take it right at the beginning, because it stops the production of the virus.
Okay.
So basically cuts if you take it within 2 hours to 4 hours, 5 hours a day, cuts production of that virus by half.
Wow.
So that's the reason you're feeling a little bit better. But at the end of the day, though, you're still going to be sick for 7 days. And people have taken Tamiflu at day one, like the first hours, and the ones who haven't taken it, the difference is 6 hours. 6 hours.
6 hours.
Means that you're going to feel better than being at day, let's say on a Monday afternoon.
Right.
You feel better, totally normal at 5 o'clock. You're going to feel better at 11 a.m. Is that $200 worth it for that?
I see.
And the only time it's recommended by the CDC and infectious disease, anybody else, is only for people who are immunocompromised and in life or death situations.
Wow.
Otherwise, for a normal, healthy people like you and I and everybody else out there, it's really not recommended. So I know, and some people just insist on that's fine. But for sure, even the manufacturer says it can only take it the first 2 days. After day 2, it's not going to work. But I'm here to tell you, after day 1, it's not going to work.
Wow.
And if there's anybody out there who disagrees and has an experience, that's fine. More than happy to hear your opinion, just because of the fact that we'd love to hear your opinion.
Absolutely.
And please share this on your Facebook page. I think we are giving information. So when you go to the doctor's office, if the doctor says it's a virus, it's okay to say, how do you know, et cetera, et cetera. Make sure they check you for other things. But in reality, a virus is a virus, and there's supportive care. For the cough, we can give you inhalers, steroids.
Okay.
For the nose, we can give you medicine for the runny nose. For the fever, we can get you medicine for the fever, dehydration, all that. But it's all supportive care. But the human body is perfectly capable of taking care of viruses.
Wow. I mean, that's something. I mean, that's a lot of people are having the flu right now. I mean, I just came in and heard on the radio that people were giving people instructions on what to do as far as if they have the flu and things like that. So it's pretty serious out there.
Yeah, and there's things you want to spread it. I mean, obviously, carry, if you have the flu, wear a mask. Everybody else around you wear a mask. If you have a partner you sleep with, is make sure you're sleeping in a separate bed, because it's by breathing on. If you're coughing, they always tell you cover yourself, wash your hands, and all the things you've been taught about since you were in kindergarten. That does prevent the spread. So if you have the flu, I mean, it's okay not to go to work, because all it takes is one person and take out an entire office.
You're right. You're right about that.
Like as you know, I take care of the Georgia State football team and the different professional teams. If one of the athletes has the flu, that player is immediately isolated and quarantined from the rest of the team.
Wow.
Imagine going to we were going to a bowl game. One player had strep, and we immediately had to isolate him to make sure that he did not infect right before the game, a week before the game, the rest of the team.
Wow.
So it is contagious, the flu, but the good news is, in the scheme of life, just one minor bump in the road.
And if you guys want to call in, we have the call-in number right there. So if you have any medical questions at all, this is your time right now to call in. We're not going to be on here forever. Dr. Farrar is a busy man, so.
No, we have all the time.
Yeah, so please call in and ask us your questions. Ask us any medical questions that you might have right now, because this is your time to actually call in. You see the call-in number right there in front of us. So please feel free to call in and just let us know what are your thoughts. Should you use an antibiotic, or if you have any other health questions, just feel free to call us in right now, and Dr. Farrar is here to answer your questions for you.
Dexter, some people say, but I had my antibiotic, and immediately 5 days later I felt better. And a lot of times, my answer is, if you didn't take the antibiotic, you probably still would have felt better.
Okay, I see.
But sometimes it's placebo. Okay. And I get that all the time. Or they come in at the tail end. He goes, I just can't shake this off. And the other doctor gave me an antibiotic, and then 2 days later I was better. But, how do you know you wouldn't have been better? So, fortunately, thank God, at my clinics, our doctors are very good about education, and we do the best we can, because long-term antibiotics will harm you, plus the side effects.